welcome to SVG-TV's news for Wednesday, April 7th, 2021. I'm Triska Campbell with the details. St. Vincent's and the Grenadines today received its first tranche of 24,000 Oxford AstraZeneca COVID-19 vaccines through the COVAX facility. The procurement agency, the Pan American Health Organization, PAHO, ensured the safe delivery of the vaccines at the Argyle International Airport. Delivering remarks virtually at the handing over ceremony, a PAHO WHO representative, Dr. Yibates Gebre, described the first allocation of the COVID-19 vaccines to SVG under the COVAX arrangement as a milestone.
Today in St. Vincent and the Grenadines is a historic milestone, as well as a culmination of months of negotiation and commitment to global solidarity. In an effort coordinated by PAHO Revolving Fund, to date, 2.7 million doses have been delivered and are being deployed as we speak. PAHO Revolving Fund is facilitating access to COVID-19 vaccine for countries in the Americas and participating in the COVAX facility, and they're working with UNICEF and vaccine manufacturers to organize deliveries as quickly as possible.
The PAHO WHO rep noted the difficulty in procuring the COVID-19 vaccines as equal access and is not a privilege but a right to all people. Dr. Gabriel did not say when SVG would be able to receive another batch of the vaccines, but lauded the country for its vaccination rollout, which he said is a hopeful fight to stop the COVID-19 virus.
While there is a reason for hope, we must also remember that doses are limited and it will be several months before we can rely on vaccine to control this virus. Our goal must be to save lives, as many as possible, by prioritizing early doses for those who are at the highest risk of infection. These first vaccine doses are leveraging to limit initial number of doses for greater impact, preventing hospitalization and death. Vaccine will help us to save lives, eventually halt the pandemic.
Minister of Health, Wellness and the Environment, Sinclair Prince, thanked PAHO for supporting SVG and ensuring the country received its portion of the vaccine from COVAX.
The government of St. Vincent and the Grenadines is grateful to receive this consignment of vaccines, and we thank the PAHO WHO for the part they played in ensuring that we have access to this facility. It is our hope that our people will see the importance of inoculation in returning our country to some level of normalcy. I hope that these 24,000 that we are getting today will encourage people, give them the idea that the government is concerned about their health and that people will come out and take this vaccine.
The vaccines that arrive today expire on June 30th, 2021. And Prime Minister Dr. Ralph Gonsalves says the rollout of the national vaccination program is not yielding the numbers they expected. To date, 11,787 people have taken the jab. Prime Minister Gonsalves expressed disappointment with the vaccination numbers, noting that it is not due to the vaccination drive, but the overall reluctance of Vincentians to take the vaccine.
Can't sugarcoat it. We are not doing as well as we should be doing. And the reason for this has nothing to do with the vaccine rollout by the health authorities. We need to do better. We are not doing well enough. This is about 11% of the population. I've noticed that from the healthcare workers, the 456, if you take account that we have about 1,800 health workers of all kinds, this is just over 1/5 of the health workers. So
Dr. Gonsalves said the Ministry of Health, Wellness and the Environment needs to ramp up the vaccination drive, which would include house-to-house vaccination in all communities, especially in the red and orange zones of the La Soufrière volcano. Comparing SVG's vaccination numbers to other countries in the region, the Prime Minister said SVG is lagging behind.
But Barbados next door has done 20-something%, more than double ours. Dominica, Antigua, St. Lucia maybe close to 1/5, and so to Grenada. So we are lagging behind. Maybe we are lagging behind because we have managed thus far the COVID-19 pandemic. We have had only 10 lives lost and just about 1,605 local cases. We have had 1,700 and something cases in all, but 100 and something of them are imported. And we didn't lock the country down. And our people didn't feel the pain of lockdown to the extent of some other countries. And maybe that's one of the reasons why they're not responded as well as they should.
Minister of Health, Sinclair Prince, had said in February that their target was to have at least 50,000 people inoculated by the end of April. Today he said that while the numbers are low, he is not daunted.
The uptake has been slow. We are not daunted. Every day we try to find strategies to try to counter the misinformation and anti-vaccination sentiments making the round in the society. I take this opportunity to appeal to the many Vincentians who are hesitating to do your own research and to inform yourself about COVID-19 and the vaccine. You have a responsibility to yourself, your loved ones, and your country to so educate yourselves.
Meanwhile, Prime Minister Dr. Ralph Gonsalves is concerned that the AstraZeneca vaccines received today through the COVAX facility may not be used up before the expiry date of June 30th. Prime Minister Gonsalves said that they will ensure that the vaccines do not go to waste and will consider giving them to countries who will need them.
Sure, I wouldn't hesitate to donate whatever excess there might be from persons who don't want to take. Try to end up with vaccines, which is a scarce commodity, to have them expiring on us. That to donate to countries nearby whose populations are less resistant to taking the vaccine. I wouldn't be able, I couldn't let the vaccines go to waste, so to speak. I am hopeful, however, that we will see an uptake, as Jimmy Prince points out.
SVG recently received 40,000 COVID-Shield AstraZeneca vaccines from India, which have not yet been used up. The batch expires on June 27, 2021. Meantime, Prime Minister said he will be closely monitoring the vaccination program.
That sometime later this month, taking into account the second doses to be given to those who have taken the vaccine already, and what is the ongoing uptake between now and whenever before the end of this month, that they said to us that it doesn't look as though that we are going to be able to administer all the vaccines which we have by June the 30th, which is the cutoff date for this particular batch. Those which we got before from India is June 27th, 3 days before.
In addition to the threat of the health and safety of Vincentians that the current COVID-19 pandemic poses, Prime Minister Dr. Ralph Gonsalves says without an increase in the vaccination rate on island, SVG could see greater economic fallouts with detrimental consequences. On radio today, the Prime Minister said in the coming months it may become difficult for his government to pay salaries and honor its NIS payments to pensioners as the economic situation grows more challenging.
In 1 or 2 months, sometimes, things continue with the straitened economic circumstances that the government may not have the $30 million every month to pay civil servants and to pay the NIS contributions. Pay civil servants, those who are pensionable, and to pay the NIS contributions for current, and to pay salaries and wages. We have held the thing through all kind of difficulties. But I'm telling you, there is a real pressure on.
Given an example of another possible outcome as low vaccination rates on island, the Prime Minister said that the planned inaugural flight of Virgin Atlantic to SVG in June could be disrupted if the island is not seen as a safe spot for travelers. He explained the recent decision by Britain's Prime Minister Boris Johnson on the classification of various destinations and what that could mean for a largely unimmunized population against COVID-19.
The summer, that is from June, he is going to institute, and you'd announce it, a traffic light system for international travel by the British people. Green, amber, and red. That's why they call it traffic light. You're a country which is assessed to be green. They say you can go and travel there freely. And they allow the planes to go. I don't know the details about the amber. Red obviously means that the planes ain't going to come. But interestingly, one of the critical considerations is the extent of the vaccination in the country. We have Virgin Atlantic organized to come in June. If we are not on that green list, the likelihood is that it will not come. This is a very serious matter about lives and livelihoods.
Amidst international concerns with the efficiency of the AstraZeneca vaccine, mostly in younger people, Chief Medical Officer Dr. Simon Kisa-Beach said SVG will continue to use the AstraZeneca, but in the meantime, they will be looking to source other vaccines. The CMO said the AstraZeneca vaccines received today under the COVAX arrangements were recommended by the World Health Organization, which continues to support the usage of the vaccine, maintaining that the benefits outweigh the risk. Dr. Kisa-Beach said sourcing vaccines has to do with their availability and noted that SVG is now in a position to store any vaccine, including the Pfizer vaccine.
We said right now the main vaccines would be Covishield coming initially out of India. In terms of further vaccines, we would be interested in any of the others that are available. Initially, when we started out with the COVAX, there was an offer for the Moderna and the Pfizer, and we have made arrangements actually, so we have in country the capacity to accept the Pfizer vaccine, which is the -70, -90 freezers. So if that becomes available, we would be willing to accept that. As Doctor just said, there are some other vaccines which are in the pipeline through the COVAX facility, and we would be willing to accept those also.
The CMO pointed out that they are in the early stages of discussions with the Caribbean Public Health Agency, CARPHA, on the future of administering the AstraZeneca vaccine to persons under 30.
Something we are closely looking at to advise the Vincentian public. We are also up to this morning, in constant contact with CARPHA in terms of guidance on what we would do with the concerns. However, throughout this entire process, relative to the clots, it has been stated that the benefits of the AstraZeneca Covishield vaccination relative to the very, very minor risk of clotting, there's a great benefit which outweighs the risk.
As it regards to any adverse reaction from the AstraZeneca vaccines here in SVG, the CMO said there are none and debunked rumors that suggested that someone had died in SVG after taking the vaccine.
As far as we are aware, definitely in St. Vincent and the Grenadines, we have had no episodes of persons having clots or any sort of side effects from the AstraZeneca vaccine. In terms of the region, because of the system of reporting, it would have been determined and announced if that had happened with anybody in the region. So as far as I know, we have had no episodes in the region, but definitely in St. Vincent and the Grenadines, we have had no episodes. I know over the weekend there was some reports going in social media about somebody dying with bleeding from the ears and the nose after vaccine. That's totally false. That did not happen. We have had no adverse reactions besides the normal little headache you have after vaccine, little, feeling unwell. We have had no one who has been paralyzed, no one who has died, no one who has had any anaphylactic reactions here in St. Vincent and Grenadines.
PAHO WHO representative Dr. Yetabiz Jibre said countries decide what vaccine they prefer, and AstraZeneca was the preferred choice of many countries due to its availability. He said that no one in the Americas, including the Caribbean, has any reports of blood clotting after taking the AstraZeneca vaccine. He reported that to date, more than 140 million people have taken the vaccine in the Americas. St. Vincent and the Grenadines recorded one new positive case of COVID-19 from 87 samples received and tested on April 5, 2021, resulting in a positivity rate of 1.5%. No new recoveries were recorded, leaving the number of total recoveries at 1,627. 129 cases are active, and 10 persons with COVID-19 have died. 1,766 cases of COVID-19 have been reported in St. Vincent and the Grenadines since March 2020. The public is urged to continue to use masks, sanitize, physically distance, and to get vaccinated to reduce the spread of COVID-19 in St. Vincent and the Grenadines. Welcome back. A meeting between government representatives and the various union heads yesterday ended with no consensus on the proposed vaccination and testing for public sector workers. Speaking on NBC Radio today, the Prime Minister clarified that as a part of the policy, persons will be tested once every 2 weeks based on risk factors decided upon by the health authorities, meaning that testing may not be done on some persons every 2 weeks if it is not deemed necessary. It was highlighted that the test that persons will be required to take will be a nasal swab rapid antigen test and not the invasive PCR test as widely speculated. PM Gonsalves linked the conditions of the policy being set out by the government to those in Britain, where teachers are being required to be tested bi-weekly in order to curb the spread of the coronavirus, which will allow for a return to normalcy.
The Ministry of Health doesn't have the manpower to go to everybody once every 2 weeks to do the vaccination, to do the testing. I ain't talking about you not having the tests because we could always import more tests. I'm talking physically, the number of nurses and health workers to do these tests. And that's why it says up to once every 2 weeks. And it says based on the relative levels of risks as determined by the health authorities.
In rebutting to the notion that the vaccination and testing health policy is unconstitutional and a violation of individual rights, Prime Minister Gonsalves maintains the government is acting justifiably within the framework of the country's constitution.
It is said that to ask persons to take the test, to make that test mandatory for particular categories of workers, that you're infringing on their individual rights and freedoms. The Constitution, the law, everything makes it plain that you can always restrict a right, and they're restricted all the time. In this case, in the interest of public health and public safety, it has to pass the test of it being reasonably required, and nobody can say that a test is not reasonably required for public order, for public health. And you have to satisfy the test that it is reasonably justifiable in a democratic society. And nobody can say doing a test is not reasonably justifiable in a democratic society.
With the looming threat of an explosive eruption of the La Soufrière volcano, the Prime Minister said getting tested and vaccinated is an issue of national urgency, noting that teachers and police officers, for example, will be called upon to work in emergency shelters. Additionally, Prime Minister Gonsalves said the country risks having another COVID-19 outbreak with the low vaccination rates amidst the ongoing community spread of the virus and the unavoidable close quarters within shelters in the event of a volcanic eruption.
The Ministry of Health, Simone Kieser, told the gathering, because they were asked, that right now there are tests in every clinic where the teachers and public servants and police can go to. And the teachers also have to manage the shelters. We have to rely on them to do many things. Please, for God's sake, this is a national issue.
On the government's proposed vaccination and testing policy for public sector workers, head of the Public Service Union, PSU, Elroy Boucher, said until the unions and the Police Welfare Association, PWA, receive the documents which outlines the public health and policy procedure, there can be no implementation of such a policy. Boucher told SVG-TV News there have been no clear guidelines given by the government for the application of its vaccination and testing policy to public sector workers.
The document basically is going to spell out very clearly what the policy is and the procedures. Because eventually, if this matter ends up in court, government clearly has to defend its position. You just don't roll out something arbitrarily and say, follow this. They have a duty to really ensure, as the Prime Minister said, because he said it, that the policy must be clearly and unequivocally set out the measures, and these have to be communicated to every public servant, in addition to the union. That is, you must know exactly what is required of you. And then you're adding on, of course, if the measures are not being complied with, it will constitute a misconduct. These things have to be spelled out.
The PSU president said while the chief medical officer, Dr. Simone Kieser, was able to clarify several issues at yesterday's meeting, the procedure she outlined was not yet being made clear to department heads nor public servants. This, he said, has resulted in the haphazard enactment of the policy.
You're going to be testing public servants based on what the Ministry of Health would have determined as the risk level. And Dr. Kieser was able to explain quite clearly that, for example, people who deal with COVID patients who are on the front line at a very high risk, people at the airport who have to interface with persons coming into the country, they are also at a very high risk. They even included the teachers at that particular level. There are persons who work in offices by themselves, they are at a very low risk. They are persons within the public service, a group of persons who might have to interface with the public. So their risk level would be even higher than those who are in office by themselves. So your testing is based on the risk levels as you would have determined it. What is happening in the ministries now, Treasury, Inland Revenue, is that while you public officers are waiting on this document, they are sending everybody to go and do a test. Tell them, go and do a test and bring the results. I mean, that is arbitrary. That's not what we understood. That's not what is intended.
Boucher said that the unions and the Police Welfare Association have not been opposed to testing of the public servants as the risk of COVID-19 and the need to control its spread is understood. Rather, he says it was the punitive nature by which the testing was being mandated in response to the discussion to not take the COVID-19 vaccine. He says following the clarifications received during their meeting yesterday, it is imperative that public servants receive the detailed policy and procedure of what to expect.
The union is not, our opposition to the policy is not the same thing that we are opposing testing. We understand the public health need. In fact, during the meeting when the CMO spoke, we clearly understood where she was coming from. So therefore, we embrace the sentiment echoed by her, the need to have testing. Our issue with the policy was that it was one that mandates testing, and our understanding of it was you were testing public servants twice per week if they do not take a vaccine, which to us seems quite punitive. Now, following the meeting, we are being told, well, that was not the intention, but that was not the message that the policy was meant to send. So therefore, we take a step back. This policy must stop. The implementation cannot begin unless this document or the fleshed out policy is given to public servants.
In response to Prime Minister Dr. Alf Gonsalves' comments on the use of nasal swab rapid antigen test instead of the PCR test for testing of public servants, Boucher said while he is uncertain of the variance in the procedures for both tests, any difference in the invasiveness and discomfort associated with the PCR test, which persons assumed they would be required to take, would be certainly ease the anxiety of public servants. In a joint statement issued today by the unions and the PWA, it was pointed out that no date has been given for when the government will provide them with the document for the public health policy and procedure. The unions and the PWA continue to maintain their position: no document, no implementation, stressing that they will fight for the rights and interests of essential workers while trying to balance the public health interests of the government of St. Vincent and the Grenadines. As the effusive eruption of the La Soufrière volcano continues, Commissioner of Police Colin John has outlined the role that the police force will assume in the event of an explosive eruption of the volcano. In a telephone interview with SVG-TV News, the commissioner said standard operational procedures will be in place for the police to assist with evacuations. In respect to safeguarding properties and livestock of evacuees, Commissioner John said they will be guided on the advice of the National Emergency Management Organization and the monitoring team of scientists so that officers can be stationed as close to the affected areas as possible. He said there will also be an increased sea presence by the Coast Guard.
We have had several meetings with NEMO and other bodies. From an organizational standpoint, we have set up standard operational procedures for evacuation. And that includes transportation. It also includes the security aspect of persons, their property, inclusive of animals, based on the advice of the scientists and how close they can get to the area. We would station police officers once we are given advice that it is safe. We would also have increased patrols from the Coast Guard, border patrols, to prevent persons from entering by sea in those areas.
Speaking on shelter security, Commissioner John said police officers will take leading roles in maintaining these facilities.
We will have sufficient security at those shelters. In most cases, the police officers, they take a leading role in the shelter management, and well, we're hoping that we do not have to, but we are preparing in the event that we have to manage those shelters in the event that there is an explosive eruption, as I said before, and we are called upon to work at those shelters. So adequate security would be put in place to deal with issues of that nature. There are things that are very much to the front of our minds, and we are looking forward to executing them as best as possible.
The nation's top cops said representatives of the RSVG police force and the NEMO have been in regular meetings to identify the best modes of operation for the different scenarios an eruption of the Lucifer volcano can pose and how to respond.
We, as in the Royal St. Vincent and Grenadines Police Force, we have had meetings with NEMO. Just last week we conducted what you call a tabletop exercise, looking at different scenarios, scenarios where the volcano may erupt at night without warning or at day without warning. If it erupts on the day without warning, we can see the problems or the issue where persons may be outside of the red zone and they want to return to the red zone, either to secure their family or to assist their families to evacuate. So it's something that we have at the front of our minds.
The effusive eruption of Lucifer began on December 29, 2020 and has been followed by periods of increased seismic activity. The alert level remains at orange. Barbados Prime Minister Mia Mottley calls for coordinated regional action to tackle the pandemic. This from the region when we return. Stay with us.
That was a local news segment.
The Ever Ready Funeral Home at French's is your friend in times of grief.